This video will demonstrate the proper way to fill out and complete the required paperwork and documentation for a field or capstone experience shift. A field experience shift is defined as any shift that is attended on an ambulance in the field setting, while a capstone experience shift is defined as any field experience shift that is attended during the capstone period of your course. Please note that only paramedic students will have capstone experience shifts. This video is intended for emergency medical technician students, advanced emergency medical technician students, and paramedic students, as well as field and capstone preceptors. These documents are required for both internal and external auditing purposes. They are very important and give credibility to your clinical experiences. The first document that you need to take with you to all field or capstone experience shifts is the shift worksheet, as seen here. Please ensure that you fill in all the areas as noted. Your name, the date of the shift, the agency and unit you are on, your arrival time, your departure time, the total number of hours you attended, and your preceptor's name. Make sure to familiarize yourself with the format of the shift worksheet. You will use them very often during your education experience. On the front page, below the information that you just entered, you will see columns, each labeled with a specific header. Let's go over them now. The patient's age and sex. Your impression or differential diagnosis of the patient's condition. A brief assessment of the patient, such as their level of consciousness, their sample history, and the evaluation of their pain if any. A quick summary of the interventions that you performed for this patient. Circle which type of patient contact it was, whether it was advanced life support or basic life support. The next set of columns is for you and your preceptor to evaluate you for this patient. You and your preceptor should mark C for competent, N for not competent, or NA for not applicable. You can find a more detailed explanation on the back of the shift worksheet for each of the areas of evaluation. The initials at the end of the evaluation are to attest that your interaction with this patient was critiqued by both you and the preceptor. The column labeled Team Lead is used in the capstone experience setting. You can find detailed information on what is classified as a team lead on the back of the shift worksheet. If this patient counts as a team lead, your preceptor should also place their initials here. The last column is for the preceptor to comment on anything you should improve on for your next patient encounter. There are 6 rows per sheet. If you have more than 6 patients, you will need to use additional front pages to accommodate the number of patients that you have. In the field experience setting, you must document each patient encounter. But be cognitive that there are several patient demographic requirements listed on your student minimum competency matrix to complete for your course during clinical education rotations. Now we flip over the shift worksheet to the back. As you did on the front page, please ensure that you fill in the areas as noted. Your name, the date of the shift, your arrival time, and your departure time. The back page of the shift worksheet is mainly for the preceptor to go in depth about anything that you did well or not so well on during the shift. These comments are there to help tailor your learning to your needs. The section in the middle of the page represents an evaluation of the affected domain. The preceptor should mark the items as they feel necessary. The signature line is of utmost importance. It's crucial that you and your preceptor sign each worksheet. Please note, if a worksheet is turned in incomplete, it will be sent back for the student to make sure it is completed. At the bottom of the back page, you will find the detailed information about the individual patient evaluations that you and your preceptor did on the front page. If there are any questions, do not hesitate to contact the clinical coordinator as soon as possible. The last document that you will need to take with you to all of your field and capstone experience shifts is the hours verification form. It's best to keep a separate form for clinical, field, and capstone experiences. There are enough rows on each form to accommodate all of your required shifts for each phase. Ensure that you place your name and your lead instructor's name on the top of the form. For each of your field or capstone experience shifts, you will document the date of your field or capstone shift, the agency and unit you are on, your arrival time, your departure time, the total number of hours you attended, and print your preceptor's name. Ensure that you have your preceptor sign this form. If it is submitted without the preceptor's signature, it will be returned to you, so that you can get it corrected. Make sure that you upload your completed forms and worksheets to each field or capstone experience shift that you attend in MC, under the Attachments tab. This is explained in the video titled How to Properly Complete a Field Experience Shift in the MC app. Also, as a reminder, you must keep up with all hard copies of your paperwork, as it must be turned into the clinical coordinator each week. Just as with any other issue that deals with clinical education, do not hesitate to contact the clinical coordinator as soon as possible.